We are going to start with the COVID-19 situation in South Korea. The country is expected to see yet another drop in daily cases, with fewer infections confirmed through 9 p.m. Korea time on Thursday.
And South Korea is set to announce revised social distancing measures in the coming hours. For more, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So, Min-jung, let's start with the local front.
Mok-yeon, we're forecast to see yet another cases drop in the number of infections today. From midnight to 9 p.m. Thursday, South Korea reported around 271,000 cases. This is about 41,000 cases fewer than a day ago and around 121,000 cases less than 2 weeks ago when the Omicron hit its Omicron peak. So cases for today may be under the 300,000 mark. South Korea has confirmed a total of 13 million cases since the outbreak of the pandemic, and this means that 1 in 4 people in the country have been or are infected after just 800 days. Things are not looking as positive for severe cases, as more than 1,000 patients have been in critical condition for almost a month.
And on these revised social distancing measures that we're set to hear about later today, we are hearing word that there are only going to be slight tweaks here and there.
Right, Mark. The Pandemic Recovery Committee met yesterday afternoon to finalize updates for what could possibly be the country's final round of social distancing measures. Authorities seem set to expand social gatherings caps to 10 people from the current 8, and also extending business hours by an hour to midnight. The extended hours will apply to venues like restaurants, cafes, singing rooms, bars, as well as indoor sports facilities. And the new measures are set to be implemented starting next Monday and will last for 2 weeks. There have been talks on completely abolishing business hour restrictions, but this option does not seem likely, as the KDCA chief said that the decline in cases may be slowed down by stealth Omicron, possibly leading to a resurgence in severe case figures. But pundits cautiously say this could be the last round of social distancing measures for the country, given the downward trajectory of the Omicron wave.
Now, Min-jung, also beginning today, fully vaccinated people, inbound travelers to Korea, the restrictions have been completely lifted. Tell us more of that.
That's right, Mok-yeon. Starting today, all fully vaccinated travelers arriving in South Korea will no longer have to quarantine. And this means no matter where you are coming from, you will not have to isolate for 7 days. And the same rules had been in place from mid-March, except for those arriving from Myanmar, Ukraine, Uzbekistan, or Pakistan. And from April, authorities had initially put Myanmar, Ukraine, and Vietnam on the list of quarantine countries, but authorities have decided to get rid of it altogether. So everyone who is fully vaccinated can enter the country regardless of where they came from. Being fully vaccinated means that 14 days must have passed since the final vaccine shot, but not more than 180 days. Those who have gotten booster shots are also recognized as being fully vaccinated.
Now, you mentioned before that about a quarter of South Korea's population has now had COVID-19, at least one of the strains. As a result of this, there are a growing number of people who are complaining of long-term effects of COVID-19, this long COVID as they call it. As a result of that, the authorities here are launching research to look into the possible implications of this long COVID.
Right, Mark. With 1 in 5 infected people experiencing long COVID, officials on Thursday announced they will launch an investigation into the long-term effects of COVID-19. Let's take a listen.
There is not enough research on the long-term effects of COVID-19 worldwide. There is a limit to treating patients or managing the virus situation with the existing studies. This is why we need more standardized and accurate data on lingering post-COVID-19 symptoms to tackle the pandemic more effectively.
From current studies conducted by local health research institutes and medical facilities, 20 to 79% of patients experienced fatigue, shortness of breath, sleep, and mood disorders after recovering from COVID-19. Around 19% have visited a medical facility for these reasons. However, current studies are only based on those who were severely ill, hospitalized, or had underlying health conditions. So to create more reliable data, authorities will be conducting studies on post-COVID symptoms on 1,000 patients, including younger and healthy people, and provide an in-depth analysis in the latter half of the year.
All right, Min-jung, thank you so much for your report. Have a great weekend.
Thank you.